The hypothalamus and pituitary gland constitute a pivotal aspect of the endocrine system, playing a fundamental role in the regulation of hormones essential for maintaining homeostasis. Disruptions in endocrine function can be categorized into central and peripheral conditions, which significantly impact various glands, including the thyroid and adrenal glands. Such disruptions may lead to a spectrum of disorders that warrant attention. The classification of endocrine disorders into primary, secondary, and tertiary categories serves to elucidate the source of dysfunction. This typology is instrumental in informing treatment strategies for addressing hormonal imbalances effectively. Aldosterone plays a critical role in the retention of sodium while facilitating the excretion of potassium, potentially leading to conditions such as hypernatremia and hypokalemia. These physiological changes can have profound effects on fluid balance and the regulation of blood pressure. Primary hypercortisolism can present in various forms, including Conn syndrome, which arises from tumors affecting the adrenal cortex. A comprehensive understanding of these manifestations is vital for accurate diagnosis and effective treatment. The presence of excess glucocorticoids, particularly in conditions such as Cushing syndrome, can lead to immune suppression and a host of metabolic complications. Consequently, careful management of patients requiring glucocorticoid therapy becomes imperative. Glucocorticoids exert anti-inflammatory effects by stabilizing cellular membranes and diminishing the production of inflammatory mediators. This pharmacological activity is essential in the management of various conditions, such as eczema and ocular syndromes. The stimulation of gastric acid secretion induced by glucocorticoids could lead to the formation of ulcers, as these compounds disrupt the equilibrium between aggressive and protective factors present within the gastrointestinal tract. Chronic stress has the potential to exacerbate the adverse effects associated with glucocorticoids, thereby underscoring the critical importance of stress management in mitigating complications linked to their therapeutic use. The adrenal cortex is integral to hormone production, influencing the secretion of both male and female sex hormones. Disruptions in these hormonal levels can carry significant health implications that merit attention. Acute adrenal insufficiency can induce a rapid decline in health, primarily due to its detrimental effects on blood pressure and electrolyte balance. Immediate medical intervention is necessary to avert potential systemic collapse. Chronic adrenal insufficiency may arise from a multitude of causes, including infections such as tuberculosis, leading to a compromise in multiple endocrine functions. Symptoms often manifest as fatigue, weakness, and severe hypotension. The development of this condition can result from negative feedback mechanisms in endocrine regulation, where diminished glucocorticoid levels stimulate an increase in adrenocorticotropic hormone, ACTH, production. This feedback loop is critical for the maintenance of hormonal equilibrium. Adrenal insufficiency can give rise to conditions such as Addison's disease, characterized by inadequate hormone production. Grasping these associations is crucial for the timely recognition of symptoms and their broader implications. An adrenal crisis may present in newborns as a result of congenital enzyme deficiencies that obstruct glucocorticoid synthesis. This condition can lead to severe syndromes impacting hormone levels and overall development. Excess androgen production during fetal development has the potential to engender ambiguity in gender identification at birth, resulting in external genitalia that may resemble the opposite sex. This phenomenon underscores the profound impact of hormonal influences on physical traits. Primary and secondary sexual characteristics are governed by sex hormones, with primary characteristics relating to the reproductive organs and secondary characteristics encompassing features such as body shape and voice. An understanding of these distinctions is essential for a comprehensive biological education. Hormonal levels extend their influence beyond physical traits, impacting psychological and behavioral functions that affect mood and reproductive capabilities in both genders. Recognizing these effects is vital for promoting overall health. Cryptorchidism is a condition characterized by the failure of testicles to descend into the scrotum during fetal development, which, if left untreated, can lead to significant reproductive dysfunction. Adrenogenital syndrome, resulting from the overproduction of sex hormones, can affect both males and females and may lead to premature sexual maturation alongside other hormonal imbalances. Hypopituitarism is a condition that can result in dwarfism due to insufficient production of growth hormone in children. This disorder may be linked to receptor deficiencies, ultimately impacting overall growth. The positive outcomes associated with the removal of excess glucocorticoids are notable, as they markedly enhance the patient's condition. This observation highlights the paramount importance of maintaining hormonal balance within therapeutic contexts. Chronic adrenal insufficiency may also induce the development of secondary male characteristics in women, significantly affecting their reproductive systems. This condition exemplifies the intricate interplay between hormonal influences and physical manifestations. The presentation elaborates on gonadotropin hormones, which are essential for stimulating the production of sex hormones in both men and women. A thorough understanding of these hormones is crucial for addressing various reproductive health challenges.